Hello everyone. Today we take you on a journey of a child's lifetime of healthy smiles and their smile maintenance to improve the quality of life. This is presented by Dr. Gausia and co-presented by Dr. Nyer Firdoose from Dental Healthcare and Research Unit at Garonda. This presentation is interpreted by Mrs. Maria Goretti. Self-care skills for oral health with iTop Technique Oromotor exercises. Oral care is learned skill. We speak on the technicalities and intricacies of oral care in early life. iTop means individually trained oral prophylaxis. It is important to teach children general dental health and brushing techniques early so that they feel invested in their own dental health care. Because oral health is the mirror of general health, and the challenge is to go against the idea that oral hygiene is a tough task. Simple practical training which can be applied in an effective prevention program for already preoccupied parents. The iTop, which is individually trained oral prophylaxis, is not merely a theory, it's a skill wherein you learn the knowledge and individual technique of how to keep your teeth and gums healthy for a lifetime and be able to pass this invaluable knowledge on to your patients. Also, special focus on touch to teach approach to show just where to pay attention in individual dental care. Self-care behavior. Self-care is a skill. No medicine is more powerful than caring. And it is learned behavior and can be taught, which is touch to teach. One is not completely healthy without good oral health. Interlinking both general to oral for holistic well-being of an individual. There is always a link between general health and oral health. Like any other skill, it requires practice. Oral hygiene and aspiration pneumonia. Mouth can be a reservoir for respiratory pathogens, and the subsequent aspiration of such respiratory pathogens shed from oral biofilms into the lower airway increases the risk of developing a lung infection. And patients may aspirate inflammatory products from inflamed periodontal tissues into the lower airway, contributing to further lung insult. As we all know, saliva contains many bacteria, and bad oral hygiene and periodontal diseases lead to the proliferation of such pathogenic bacteria. It is very important in such situations to take care of non-ambulatory adults and children, including frail elderly. Self-care skill of oral health with a flair of individually trained oral prophylaxis. This is a pre-tooth brushing stimulation which is integrated with pre-feeding program. As we all know, there is inherent aversive response in and around the mouth when one's personal space and any stranger's close proximity, which can be distressing, leading to general resistance to having the teeth brushed in children. Therefore, early intervention to desensitization and calming the sensory seeking stimuli is important prior every feed, followed by cleaning and massaging of gum pads as an attempt to provide sensory stimulation and deep pressure proprioception to ease the fear of a threatening to non-threatening stimulation. How is oral defensiveness combated? The oral defensiveness is combated by oral desensitization. Of all the daily care activities, mouth care is particularly intimate and intrusive. The aversive response of an infant is an actual defensiveness around the mouth area and general resistance to having the teeth brushed. Therefore, it is important to inculcate good, healthy, and positive behavior much early in infancy rather than trying to modify or change the aversive negative oral care once established. Oral alerting exercises and oral calming exercises. The oral sensory input is the foundation for oral motor development. The oromotor activities of sucking, swallowing, breathing are benchmark for first motor control. Now, brushing teeth is sensory experience associated with various textures, flavors, and can influence both hypo and hypersensitivity natured individuals. And to improve muscle activation and alertness, these oromotor exercises are important. They are also important to distract from unacceptable social or negative behavior and also to calm self. And a mirror can be used to predict the sensation. There are two types of response from the mouth when it comes to food, which is either alerting or it can be calming effect. These responses are based on textures, flavors, and temperature, and the effort of oromotor activities. The textures can be crunchy on biting or smooth, creamy, and succulent. Taste wise, they can be sour, bitter, and or spicy, and the calming tastes are sweet, bland, or herbal teas like chamomile or lavender. When it comes to temperature of food, it can be either cold, which alerts the senses, or warm, which calms the senses. And the efforts taken to chew the foods, as in crunching, biting, sucking, swallowing, or even chewing, makes up for the oromotor activities. The function of such responses is to either awaken or calm the orofacial muscles. Assistive toothbrushing. Before ever trying to get inside a kid's mouth with a toothbrush, we should observe his or her reaction to external stimulation in the general area of the mouth. There can be a bite reflex, which is an involuntary biting of anything placed inside the mouth of an infant, which usually disappears after 6 months. If the infant closes the jaw to bite up and down when pressure is applied on the gums, this reflex integrates by 9 to 12 months. And it is important for older children, the parents should stand behind them and help them by hand over hand prompting guidance technique. And once the child is showing little to no resistance, this kind of stimulation gradually concentrated more on lips and move inside the mouth. If the child tolerates a soft toothbrush on the front teeth, use that, else use a face cloth or sponge. We should be careful about using our finger unless the child does not have a strong bite reflex or the child trusts you enough to not bite you. Two toothbrush technique. It is always important to explain to the child what you are doing and proceed very slowly so as not to upset him or her. If the initial reaction is negative, the process should be discontinued for the moment and a time is set aside each day to gradually get the child used to it. We should try putting the paste on the child's lip to see if the child licks it. And the use of large handle of one brush to pull back the cheek and allow the child to rest teeth on the handle, whereas the second toothbrush is used to brush teeth. They say the highest form of learning happens in play, and the play based toothbrushing behavior. This is a meaningful and fun activity which can make brushing an enthusiastic task. The children develop the dexterity of handling dental floss by approximately at the age of 10. And few teeth which fits closer which and tightly may require the use of dental floss. The take home message for today's presentation is touch hearts to teach minds, and skill building to address the rejection or the resistance to oral hygiene care, as mouth is a very vulnerable area and it has more tactile nerve endings than any other part of our body. Thank you.